beautiful love. It's the 6th of July 2024 and this is Tavistock Devon's third Pride event. I'm in Devon. It's the 6th of July 2024 and this is Tavistock Devon's third Pride show and parade. Let's go! The Eddystone Trust is a Plymouth-based organisation.
So we were founded in Plymouth, but we cover the whole of the southwest. So yes. We work from Gloucester all the way down to Cornwall. We work doing HIV prevention and sexual health charity. So part of the organisation is support work with people living with HIV and then prevention around HIV.
And you've been going since the mid-90s, really, haven't you?
It's early 90s, yes.
So it's been a very important period to cover.
Yeah, so the landscape of HIV has been changing over the past 40 years. So it's no longer a death sentence as it was in kind of the 80s/early 90s.
Yeah.
If you are diagnosed with HIV, you will go on to medication, and what the medication does is it reduces the virus.
Yeah.
So there isn't a cure at the moment for HIV. What the medication does is reduces it to something called undetectable, and there's something at the moment which is called U=U, that is undetectable equals untransmissible.
Right.
That means someone living with the virus who has an undetectable load has no fear of onward transmission.
You carry on with a normal life.
So you could have condomless sex without fear of onward transmission of the virus.
Yeah. Well, I recorded Plymouth World AIDS Day in 1992.
Okay.
When it was a very difficult time for people with HIV.
Yeah.
And it was still a death sentence in some areas then.
Yeah.
And I was at the College of Art and Design, and there was a bit of an attitude with some of the lecturers there. And I found an awful lot of hypocrisy as well, because I found that their behaviour was quite often worse than the people that were putting down, which is typical of the system anyway.
The biggest part of HIV at the moment is the stigma that is related to it.
Yes.
So people still have outdated views of what it's like to live with HIV, how the transmission of HIV happens, or the acquisition of HIV happens. So it's about kind of educating yourself about where we are at the moment. There is a campaign at the moment in the UK of no new diagnosis by 2030. And what that's done is the things that have been done to kind of eliminate the transmissions are in A&E. If you present at A&E in certain, I think there's 6 A&Es throughout the country, you automatically get a bloodborne virus test which includes HIV. And in the first 100 days there was 122 new diagnoses of people who were living with HIV but didn't know their status. So that's really important.
Because there's still the 12-year itch with the HIV. You can have the virus up to 12 years and still be having sex.
So it's called a late diagnosis, where people have been living with the virus, and in the UK the percentage of people who are diagnosed late is over 50%. So it's people who may not think that they can be affected by HIV, who can.
That's men and women, of course.
Men and women. We saw last year, for the first time in the 40 years, the new cases in the UK in heterosexual males and female overtook gay, bisexual, MSM men, only by like a 0.02%. But it's getting that wider message out to people that anyone can be affected by HIV. It's not seen as the gay bisexual disease as it was in the 80s and 90s. Anyone can acquire the virus.
I just remembered actually, because when I recorded Time to Act in 1992, it was the first time I met the Eddystone Trust.
Okay.
So you've been going all that time, and that's on the video as well.
Yes.
So if you look at Time to Act on YouTube, it's very informative because a lot of people are going through the politics of the day. And it's strange the backgrounds of the people. They catch the virus as well, you know, and it opens up on the video as well.
Yeah, I think now with like more sexual freedom with people, people are having sex with different groups, so bisexuals, swingers, transsexuals. So, you know, it's not a virus that's limited to just gay, bisexual men anymore. We are seeing
it. Never was.
No, it wasn't. But that was how the perceived.
A lot of it came through, bad blood from America.
Yeah. So the first time it was referred to as GRID, which is gay-related immune deficiency, and that actually wasn't by a medical. It wasn't by the medical profession. It was actually by the New York Times, that actually put this grid together, which is moving forward, kind of. So PrEP is now available on the NHS if you meet the criteria.
Okay.
That's a really good way of limiting the transmission of HIV. It's like 99% effective when taken as prescribed. So that's part of the new diagnosis by 2030.
Is there an increase of STDs at the moment?
So the figures, the data for 2023 has just been released. What we're seeing kind of across the UK is an increase in gonorrhea and syphilis.
Yes.
And that isn't specific to any kind of sexuality, it's just a rise across the board as well. The thing with syphilis is with home testing kits, so if you were to order a home test kit, you will always get, if you've been treated for syphilis in the past, you will always get a positive result. So if you feel that you may have syphilis, you need to get a face-to-face appointment, because if you just do a home test kit and you've had syphilis and been treated in the past, it will always produce a positive result.
So how can people contact the Eddystone Trust?
So you can go onto our website, which is www.eddystone.org.uk, and we've got a free phone number, which is, off the top of my head, 0800 328 3508.
Right, cheers, thanks very much.
Thank you very much.
The Eddystone Trust is a sexual health charity based in Plymouth, which was set up in the 1990s during the HIV/AIDS pandemic. You can contact them through social networks. Thanks to the incredible organisers and people of Tavistock Devon 2024. And thank you all. Music on this video with great thanks by Jasmine from Plymouth. Love Summertime TV Worldwide. You can contact us at ccsvirtual1@gmail.com. Don't forget to friend and share the video.